Okay, so today eventually we'll talk about injury recovery and endurance. My name is Baljinder Chhoker. Bal Chhoker, there's my email. You'll see it in here too. As I say, you don't have to write anything down if you don't want to. You can email me. I'll get you this presentation, PDF. Okay. A little bit quick about me. Went through Naturopathic College. I've been consulting for 20 years now with various companies, so on. I taught TA at CCNM also. I've been in the retail sector, is where all my knowledge of the supplements comes in. Right now, well, not right now, it's been almost 7 years. I've been the National Educator for Baljinder Chhoker Homeopathic. So I do all the education across Canada for the supplement lines we carry, homeopathics, chemotherapies, nutraceuticals, everything like that. But I don't believe that knowing our stuff is really the way to go. You need to know everyone else's stuff, all their products, and know how to incorporate yours into it. So then again, this is where then my course came about. I've taught anatomy physiology. God, the most boring thing ever. Oh, sorry for all those who have not taken it yet. Actually, Linda does a good job. Linda's very excited about it. Hopefully you get Linda. She's very excited about teaching anatomy physiology. She loves the cell, okay? I've taught it, but I think the best was when she taught the first half and I taught the second half, because when it came into systems, it was just much more interesting. Incorporating things, right? But, oh God, hopefully never again. Currently, I teach a supplementation clinical practice, a continuing ed course here. It is taught here. Oh, don't have it there. Okay, basically it's taught here in October, November, Tuesdays, and May, June in the Mississauga location. Okay? There's contact there too. You can call me, text me if you want to also. So really quickly, I'm going to give you the gist of the course. By the way, for all those who don't know why people do these talks, it's really because there's continuing courses going on. And it's a promo for the continuing class. So we're going to get to that right now. I've got a very simple course. It's a comparative use of supplementation based on systems and conditions, pathologies. It's a course I've completely designed myself after seeing the previous person who did this, and this is going back now almost 5 years ago. Those notes, and it didn't make any sense to me as to what a comparative course should be. I can get that stuff out of pretty well any book. You know, this much is what's needed of this nutrient, this is the toxicity, this is where you can get it from. But if you do supplementation when you get out, it's really about taking what's actually already there in combination to make it easier to prescribe. People hate doing 20 different bottles of things, all right, of single nutrients, all right? They'd rather have 2-3 bottles if you're lucky and get maximal effect out of that. And this is again where the course came out about trying to make it easy for people to start and still get therapeutic results, okay? How many plan to do supplementation when you get out? Okay. Okay, you did. No. So, what will be your main method of treatment when you get out?
I don't want to do any treatment.
What is it that you plan on doing, sorry? After taking this course? Don't want to put you on the spot, but I like to know what people do. And
taking what course?
This whole program.
Well, I don't really want to.
You don't have to say.
I don't feel I need to share it.
Okay, no problem.
I'm not going into clinical practice. That's
okay,
not
and that's fine. I say you don't have to share if you don't want to. For the others, and the reason I ask is when you get out there and if you are seeing clinically, food will get you so far, and I always say food is a great maintenance. But people come to you when they actually have a condition that is limiting what they can do. So then you have to therapeutically treat them. So adding some supplementation into the mix therapeutically to get them to their goal, and then taking the stuff out, and then letting the food and the lifestyle take over is what will happen when you get out. That's probably what you'll see. How many of you work retail in a health food store, just out of curiosity? No one. So if you plan on doing this and going into clinic,
I work in part-time.
okay, it's a very good idea. This is actually how you learn all this stuff. Okay? Supplementation is great. You're going to need it, and we're going to talk about the comparative use of it. Okay? But this is just one of those things that if you are going to go out, and a lot of the courses are now getting into it, you will need it. Okay? So as I say, this is the main condition I talk about. The bonus of my lecture, my course, I was looking at the slip, I think it's like $440, which is about cost of every continuing course, 9 weeks. The difference between my course and everyone else's course is this and that. Everyone walks away with that kind of stuff at the end of my course. I work with about 20 companies to bring this course to you guys, and the companies are very nice to me, which means they're very nice to you. So you walk away with full-size bottles of all of these things, which works out to be about $1,000 worth in retail of product that you get back for taking the course. Okay? All stuff that I think is probably some of the best from those companies. Majority of them I get to choose exactly what I want, okay? And it changes depending on the company, but that's really what you walk away with, and hopefully some knowledge on supplementation, okay? So, having said that, let's get into musculoskeletal. Going back to anatomy physiology, and maybe going to anatomy physiology if you haven't got there yet. Musculoskeletal system, because it's the bones, muscles, tendons, ligaments, joints, cartilage, and connective tissue, okay? All of these provide, right, to work together to provide form, stability, and movement. It's gonna be on a quiz somewhere in anatomy physiology, don't worry, all right? That's really what the musculoskeletal system is all about. So when you look at stability and movement, if people are not moving, that's hindering what they do, okay? That's when they want to seek out help. Injuries result in the inability to walk, sit, or even breathe, and therefore have substantial impact on the health of Canadians. Okay? There's lots of pain, mild to severe, and if it goes chronic, it's usually severe, and lots of it. There's limitation in physical function and also fatigue. Okay? General aches and pains result of day-to-day activity and sports-related injuries which lead to pain and inflammation. They may require treatment. So, inflammation and pain is a good thing. Okay? Initially, when it happens, it's about limiting the body to what you're supposed to be doing. It's a signal telling you, hey, stop what you're doing. We got a problem. We need to take care of it. And if it's minor and you stop what you're doing, it will actually go away and heal itself. If it doesn't, then we need treatment. Okay? And it could be any type of treatment that you want. Normally you'll see stiffness, movement, bruising. If it gets worse, you're going to see erosion, deterioration. Okay? Restricts daily living. Okay? The functional and social limitations associated with musculoskeletal disease often have emotional consequences, such as anxiety and depression. Again, if they can't do what they love to do, it's going to impact them mentally and emotionally. Okay? This is how prevalent it is. 4.2. Back in 2009, 2010, almost 10 years ago, 4.2 million Canadians, right, that's 15%, suffered injuries severe enough to limit their usual activities. 15%. Okay? It's obviously increasing. The more activity people do, the weaker their system gets, The more stress they're under, the less nutrients going in to heal the body, the numbers are just going to keep going up and up and up. Okay? Overall, falls were the leading cause of injury. 63% of the seniors falls, adolescents, and then working age adults. Now, young people aged 12 to 19 had the highest likelihood of injury. They're playing a lot of sports. Okay, so there are going to be lots of it. Okay, more than a quarter of this age group suffered an injury, all right, which is double the adult population and more than seniors, triple. Okay. Which tells me two things. Either kids are doing too much. A lot of kids are playing 2, 3, 4 different sports, so they're going to be prone to it. They're not getting proper stretching, and they're definitely not getting proper food to maintain and strengthen themselves. Okay? So it could be any one of those things that you got to figure out what's really causing all this. Okay? Seniors. Okay, so 2 out of 3, 60% injuries among adolescents were linked to sports also. Okay? Workplace injuries. And 50% of seniors' injuries occurred while walking or doing household chores. Circulatory issues, stability issues, visual issues. All right, you have to look at all that kind of stuff. Sprains and strains, by far the most common injury, 51%, followed by fractures at 17%. Okay? Now, this to me is easier to treat than this. When a fracture happens, they get locked up at that area, get bound up, and they can't do anything so it can actually settle and do what it's supposed to do. Sprains and strains, trying to get someone to stop doing what they're doing is hard. All right? Unless you can strap the whole thing down, get them on a crutch, for ankles, and you'll see ankles is number one injury that happens. All right. If you can't immobilize it completely, it will continuously get worse and worse and worse. It never gets a chance to heal. Fractures get a chance to heal. So this takes longer. Okay? And treatment, they seek treatment after a later period of time too. Okay? So this is really what happens. Okay? So as I said, this is harder to treat, or longer to treat in most cases, than a fracture. Okay, so a couple other injuries, low back injuries amongst working adults, one of the most common ones. Okay, ankles is truly the most common injury there is of the lower body, and it's of the whole body, and then upper body. All right, elbows, shoulders, arms. Usually, what happens when they fall. Okay. This is actually from 2016. The Ontario Association of Naturopathic Doctors did a survey of why people seek naturopathic care. I was actually surprised by the results. Okay. Number one reason, neck, back, and joint pain. Right? 15% of the population it happens to. This is the number one reason they are seeking care. Arthritis falls right into that's a little over 30%. All right, for musculoskeletal itself. I was surprised that this was so low. Anxiety, mental, emotional. I thought that would be much higher. Anybody else think that would have been higher? Because it's very rampant. That is the number 3 reason why people seek naturopathic care. So which also means that's probably what you're going to see. Okay? So get a handle of this stuff, because you will see it. Okay? Injuries. What do we got? Types and causes. Acute. So general trauma, automobile accidents, bumps, bruises, slips and falls, scrapes. Acute to chronic. Sports injuries, fractures, sprains, strains, tendinitis, frozen shoulder. Then we got chronic. Repetitive strain injuries, carpal tunnel, tendinitis, back pains, and of course, the arthritic tendencies. You'll see all of this stuff. Okay? And as I said, you will have to address it dietary-wise, because if there's chronic inflammation, you have to take that, whatever is creating that inflammation in the body, out. Okay? So all the foods and anything else that you eat has to be taken care of on top of that. So, don't suppress movement. When you resist the difficulty, you antagonize it and it bites back. If you suppress something, it will come out later and be worse. So you need to actually manage it and then heal it. That's actually your goal. Common factor in all this, inflammation. Here's where this comes into play. Inflammation leads to increased pain and further restriction. As I said, that's a good thing. You want that. All right? If you injure yourself, you have to immobilize it so the body can heal itself. If you don't do anything here, and believe me, nobody does anything here at that stage, it leads to tissue erosion and increased scar tissue. So any injury, if you hurt your ankle, you're going to get scar tissue on the healing process. If you delay this whole process, first the increased inflammation in the area is going to cause tissue erosion. Right? So simple thing here. If this is your knee and you've injured that thing, the body is trying to repair itself, and as the cells are repairing, you're pushing out more toxins out of the area. Inflammation sets in. All the good stuff that's supposed to come in to help repair is not going to come in. It becomes a brick wall around this whole thing. All right? And all the bad stuff this thing's trying to push out in its repair mechanism is getting stuck inside. And if it's getting stuck inside, you're going to get further destruction and erosion on the inside, because nothing good can come in and nothing bad can leave, right? Because the inflammation has gone into a chronic stage. So you need to, at that point, start getting rid of that inflammation fast. But that is still where you don't see people. When it decreases their quality of life and they get the mental, emotional changes going on, that's when they come to you. Now they can't function like they're normally used to. There's limitations on when they can go out, what they can do. They can't do their gardening anymore. They can't play their sports anymore. That's when they seek help. We are all the way down here. It's going to come back. It's going to take much longer to take care of this. You're actually going to have to go back the other way to get the healing process going. Okay? So, you have to train these people, and this is where we got to start taking care of things, not when it's all the way down here. Because if you don't get the inflammation out, you're not going to start the recovery process at all. So, your goals: mitigate the inflammation. Okay. Therefore, we get pain reduction and we get some symptomatic relief. You got to optimize the blood flow to and within the affected area. As I said, if you block it all off, nothing good's going to come in, nothing bad's going to leave. You're not going to get any healing going on. You're just going to get further destruction. So you got to stimulate cartilage recovery by promoting tissue oxygenation, as well as the intake, absorption, and assimilation of nutrients. You got to get them to the site, and you got to get the waste out. And then you got to give nutrients to support cartilage metabolism, the repair side of it. Okay, this is just stimulating the repair cycle. You still now have to make sure you load up for the repair. So the basics, you may all know this. You need some anti-inflammatories, turmeric, boswellia, proteolytic enzymes, we'll go through that. You need basics here: proteins, greens, vitamin D, probiotics, vitamin minerals. So you don't need all of these, but you're going to need some of these things. Protein, amino acids are the building blocks of everything in your body. Okay? Most people think proteins are about that person working out. They need to bulk up. Okay? That's actually the number 3 reason why I tell people to do protein. Number 1 is actually immunity. It's the building blocks of your antibodies. Number 2 is neurotransmitters. Okay? Number 3 is that repair cycle that you're looking for. All right? They are the building blocks of everything. So you need to make sure there's a good protein content going in, because these amino acids that you're looking for are what are going to help repair the whole process and help the muscle repair, help the connective tissue repair, everything like that. I'm going to tell you, go read up on master amino pattern. Best supplement in the world. Go read up on it, you'll figure out why eventually. Okay? It's actually just the 8 essential amino acids, the building blocks of everything in your body. Okay? Greens, the reason why greens here, long-term chronic stuff, you need to alkalize the body. A lot of nutrients in greens, but you need to alkalize too. An acidic condition leads to more chronic disease, arthritis, and degeneration in the whole system. Digestive health, basic nutrient supply, a lot of anti-inflammatory support and tissue repair. And we're going to look at these things over here, cartilage builders, okay, glucosamine, hyaluronic acid, cell membrane, collagen, and the other anti-inflammatories and nutraceuticals that actually help all of this work better. Okay? So inflammation control, first thing we need to do, control the inflammation. Now, we don't want to stop the inflammation. As we said, inflammation is a good thing. It's about the pain relief you're going to get, and it's about movement of that inflammation through the body and out. So we can take an Advil or a Tylenol and stop that inflammation, but once it wears off and somebody, when they take the Advil or Tylenol, they think the pain is gone, so they overdo it. They overdo it, making the whole thing worse. So it's more like a Band-Aid on this thing until it comes off, boom, all right? You're right back to where you were or worse. So we want to actually move the inflammation out to get some pain relief and start the recovery process. My first choice, proteolytic enzymes, okay? Anybody familiar with who's not familiar with the term proteolytic enzymes? Okay. So you've all heard of digestive enzymes that you take with food. What do enzymes do? They break down things. Simple as that. All right, I like to keep it very simple, all right? You take something big, throw an enzyme into it, you break it up. Now food-wise, we take digestive enzymes right with food to break up that food particles into nutrients that the body's going to use, okay? If you don't break it down, you're going to get further sensitivities down the line. This is where all the allergies come in from the foods and everything, because you're not breaking it down to the nutrients that the body needs, right? They become allergens further down. That's one way to do enzymes. The second way to do enzymes are what we call proteolytic enzymes that we do not do with food. They're done on an empty stomach. So this is about inflammatory aspect of the body. They're enteric coated. Enteric coated means that they have a coating on them that they will not break down in an acidic environment. They will get down past the stomach into the intestine where it's alkaline. That's where they get dispersed, and they find the fibrin, other components. Really, it's looking for the inflammation and trying to break through that barrier I just told you. Remember, what does it do? It just breaks down things. So that saran wrap, brick wall, whatever you want to do it, just going to punch holes through that. So now, good nutrients come in and bad stuff gets out. Simple as that. That's really what enzymes do. Now we're doing these as an empty stomach for inflammatory movement, help remove inflammation from the body, and including the blood vessels, general trauma. This is, to me, over 60 years old, out of Germany, probably the best long-term inflammation reduction in the body. Okay, it's not vegetarian. There's a vegetarian option coming up. By the way, when I give examples of any of this, I always give options, because people are going to come to you with options. There's always going to be limitations, what people will do and will not do. Okay, so if there is a non-vegetarian thing that I think is the most important thing you can do, but the person says, not going to happen, there's always an option, just so you know. In all supplementation, there's always an option. And you will always need to know that option, because people will throw things at you that you wouldn't believe. Even though this is the most important thing, it's going to get the fastest job done for you, they'll say no. All right, we got to back up. Nothing to worry about. Okay? So, enzymes. They break down plaque, they help break down scar tissue. Remember, if it stayed too long, you got scar tissue happening, erosion and scar tissue. So, break down the scar tissue, that's how you get your flexibility back too. Maintain blood flow and drain the inflammatory toxins that flow through, good in, bad out. Okay? There's a couple of different ones that they have from Women's Ed. There's actually 3 different ones. I still prefer the original. I found the original still works the best. The drawback on the enzymes, over what we're going to talk about in a second of herbs, is that A, they're an empty stomach, at least an hour away from food. Otherwise, there's no point in doing it. They become very expensive digestive enzymes. And because they're small, because even kids can do them, you do have to do a high dosage. You're looking at 5 tablets, usually 2 to 3 times a day. At an acute, you'll do 15 a day. Right? I've gone as high as 30 tablets a day, right? But in an acute, again, they're the size of that nail. It's like a button size, and they're thin, so you're going to do 5 all at the same time. But you need to do that high dosage because they don't have gigantic pills. Even though this is supposed to be bigger pills, so you need 3 only, I still found the original works better than any of the other options they have. Okay? And it's, again, all about moving the inflammation up, not stopping this thing. The option for vegetarians, serrapeptase. So still a proteolytic enzyme. Helps to remove the inflammation. All right? It's an extract from silkworm extract, not from the actual silkworm, an extract that's used from it. So it becomes considered to be a vegetarian source for the enzymes, all right, that people can do. Again, empty stomach. Normally you're looking at usually 1 to 2 pills of this, depending on what potency you've got. If it's 120,000, which is really the highest activity unit, usually 2 a day will do the job. Okay, so this is a secondary option. As I said, this still works better if you can get it into them. Okay, so there's your 2 options for proteolytic enzymes. All about moving that inflammation out so that you can get flow happening. Take a step back. In my simplified terms, all pathology is a blockage. Wherever there's a blockage, you got pathology. The body is all about movement, continuous movement, right? When it becomes stagnant, we've got problems, right? This is why the enzymes are going to allow for that free flow to happen so you can get the healing process much better. Yes?
I have a question, like for frozen shoulder, they already have limited the movement. Is it still working or it's too late to use this one?
This is acute or chronic. And when you look at, let's go back right here. See this?
Movement.
Break down plaque buildup and scar tissue.
Okay, so still use.
Lack of movement
Yeah, they have limited
is
movement.
inflammation, but if it's chronic, that inflammation is at a much lower rate. But it's that scar tissue that kicks in, right here. See this?
Okay.
The scar tissue kicks in,
Yeah.
and now that is going to decrease your range of motion.
Yes.
Okay, so it takes time, but you're going to move that. You have to get rid of the scar tissue to get the flow happening. So this is really the key thing that has to go in, and it has to go in for a couple months here. It's not going to be a short-term thing.
Okay.
Right? Short-term is acute. Right? We're looking at chronic in this case. Prescribing acute and chronic. Sorry, I like to jump depending on where it goes. I have this rule of when you prescribe anything, and this is severity dictates frequency. The more severe the situation, the greater the frequency you're going to give something. Your dosage will be 5 tablets, one tablet, but in an acute situation where the body needs to get rid of this fast and get under control, your severity and your frequency is going to increase, right? In your case, it's chronic. So acute, high frequency, chronic, man, people hate doing things at a high frequency during chronic. You know it's going to take time, so you can do morning and evening in most cases. Acute, you get a cold, right? You want to get rid of this thing in a day or 2. So you will do whatever you need to do to get over it. So somebody for the 3-4 days will take something 6 times a day if they need to get rid of this thing. But if you know you have to do this for 3-4 months, they're never going to do that many times a day. So morning and evening. So in your case, for the chronic nature of things, morning and evening, 5 tablets of the the wobenzyme, that's it. In acute situation, I might be giving it 4 times a day. All right? So severity dictates frequency based on what's in front of you, all right? Acute or chronic. Okay, so those are your enzymes. Now, what you would be more familiar with, the herbals, the turmeric-based products. Turmeric is one of the most potent anti-inflammatories, and it's very good for quick pain relief. Okay? So, if somebody comes in and their thing is they are in severe pain from spraining, from a fall, whatever it is, and there's lots of pain associated with it, turmeric is going to be the fastest acting thing for pain relief. The enzymes, they don't work as fast. It may take about a week to really start moving that pain and getting that pain out. But the herbals will do a much faster job for pain. So where are they at? If they just came to you at that time it happened, you're probably going to start with a herbal product, okay? Much faster acting for pain relief. Here is probably the best turmeric extract there is, or product, I should say extract, the actual Longvita form of turmeric, probably one of the highest absorbing into the system. Turmeric, which I think everybody uses, but they don't realize is actually very hard to absorb by the system. All right, you have to enhance its absorption. Straight turmeric by itself, unless you're going to do tablespoons of this thing, it's not going to do much for you. And it needs a fat to actually stay in the system long enough to get to the target area to do its job. And that's what the pills are all about, enhancing the delivery to the target site. These guys use this soy-based lecithin, but they don't just attach it to a lecithin, all right? They actually take this turmeric and put it right into the middle of a fat cell. Your cell membrane, phospholipid bilayer, it's fatty membrane, all right? So what this is supposed to do is, as this ball's coming up to the cell membrane, it basically disperses right and becomes part of the membrane, so it delivers that turmeric right where it needs to. It has to be there to the target site. This is the highest absorbing and fastest acting turmeric I have seen. All right, at 2 pills, you don't even have to go to this to 4. Within a couple of hours, the pain starts to come down. Now, yes, you're going to have to give it more often, obviously. All right, it's not like after 1 dose is going to do the job, but about 2 pills spread throughout the day, you will start seeing the pain relief coming within the first couple of dosages. Okay, wobenzyme and the other stuff, it will take up to about a week to really get that happening. All right, so the herbs do a much faster job. This, as I said, are one of the most potent due to the delivery site. Now these numbers, they don't look big. 133 milligrams of turmeric. All right, this one here, 42 milligrams of turmeric. Doesn't look much. The equivalency, 2.5 grams. 30 times that, what do we got? Somebody do the math for me. 31 extract. That's the equivalency of the true amount of turmeric that they're using. But they're getting this high extract that's going to deliver at a low dosage into the site. So this guy, an option. The reason why there's an option, some people are sensitive to soy. All right, they're either allergic or sensitive. I don't care about people who don't want to take soy for other reasons. The amount in here is very low, but that's actually its delivery enhancement. This is a non-soy option. It's using polysorbate 80 and a synthetic fat to do the same thing, to get you to that target site. All right, 60 to 1. So in a way, if you look at the equivalency of this guy here, 133, double that, you get about 82 milligrams per pill equivalency wise. Okay, so the other one's still stronger. Okay, so you got one here that's a non-soy alternative to the previous one. Not as fast acting, okay, but you can, with a little bit higher dosage, get the same results. Okay. Here is what I think is the best anti-inflammatory product for pain relief. It's a blend. That same turmeric at a lower dosage as the first one. Boswellia, which is frankincense, really potent, long-term anti-inflammatory and cell healer. And ashwagandha. What is ashwagandha used for? Anyone know?
It's an adaptogen.
Adaptogen. That's right. So acute we can use it, but also chronic. Ashwagandha, if it's an adaptogen, working on the cortisol levels of the body, helping control the cortisol so the inflammation comes down lower long term. Okay? So that's why I think this is one of the best anti-inflammatory formulas out there. 2 twice a day, probably the fastest acting. Within a day, man, they're starting to feel better. That's how good this is. You do need the higher dosage, because you're putting lower dosages of things in there, but probably one of the fastest acting overall. I prefer a blend because it hits things different ways. Okay? Really, when you look at this thing, turmeric, the fastest acting. Boswellia, after a couple of weeks, it actually becomes a more potent anti-inflammatory than even the turmeric does. Plus, it starts the repair cycle better. Okay, if anybody uses essential oils, frankincense is used commonly as an internal repair. Okay, so that's what it's doing, anti-inflammatory and repair. And the little bonus of the cortisol balancing to long-term, basically get rid of the inflammation in the body, hormonal support, right? It provides that extra long-term support and quicker healing overall. There are options on blending the two. So if somebody is coming to you at about a week, 2 weeks out now, it's already happened, they're sitting there, a couple of weeks in now, you can do blends instead of doing individual. This has got bromelain as an enzyme, serrapeptase as an enzyme, and then you got your herbs, boswellia, quercetin, curcumin, so those anti-inflammatories, plus the enzymes that are going to get the flow going. So that it's not going to settle in, you're not going to get that scar tissue that's going to be in. So you're actually doing both of these things. Again, you're throwing so many things in, you're going to go at a higher dosage. You could be doing 2-3 times a day of something like this, all right, if you really need to see the results. But you're doing a 2-in-1, so anti-inflammatory and removal. Okay? Initial stages, I don't think this is the way to go, because people need to see quicker results depending on where they are. Okay, I'm going to take a step back. Anti-inflammatory herbs versus the these guys here. If somebody is in a repetitive mode where they basically have repeatedly injured the same area, this is the way to go because of this again. They haven't got the proper healing because the scar tissue is there, the flexibility is gone usually, so they're more prone to that area. So if this is a repetitive injury, you're going to have to throw something like this in no matter what to get rid of that scar tissue so they can start healing eventually. All right? If this is a one-off, you can work with the herbals just fine. Okay? So this here, Inflacom, a blend of the two, all right? I suggest, because the turmeric is not in a fatty base here, make sure you do it with a fatty acid. Make sure it's with some fish oils or plant-based oils, and make sure it's in the middle of your food to get that turmeric to be absorbed better. But it's a 2-in-1, couple weeks in to help with that. All right, make it easy. Comparative does a pain pro. Again, you see bromelain, boswellia, turmeric, right? Basics are there, anti-inflammatory. This guy I like to use if it's been chronic now. If it's been a month, 2 months in, all right, and it's still sitting around, you need to actually provide drainage support for that area. So, stinging nettle and rosemary. Basically, you got kidney and liver support, making sure things are getting metabolized out right. But the kidneys are very important for inflammatory removal. The metabolic inflammatory metabolites are actually moved through the kidneys and out. Kidneys are very important for inflammation reduction. Okay? So this is a great chronic issue problem, okay, versus subacute versus acute. All right, so you need to know where you're sitting with them. This is why the options, this is where it comes down to comparative use of supplementation. When to use what, okay? You could get away if you only had this, of course that's all you're gonna do, there's nothing to worry about. But if you have the option to prescribe accordingly, make sure you do it, okay? Fish oils, anti-inflammatory down to the cell level, okay? It's the EPA which is doing that. Here's EPA, if you've heard of Nutri-C, this is a professional label, okay? Higher ratio, it's actually a 4-to-1 ratio of EPA DHA, and EPA is the key anti-inflammatory component out of the oils, okay? So high EPA in a teaspoon, all about the inflammation reduction. My choice of a fish oil has always been krill. Low dose goes a long way. It's basically what I call the whole food version of omega-3s. Because of this phospholipid makeup, which closely resembles our cell membrane, the oils get right to the site where the issue is. So again, low dose goes a long way. So instead of, you can get away with 2 pills of this, which is 1 gram of fish oil. A couple of teaspoons of this, you're looking at usually about 5-6 grams of fish oil equivalent to 1. Because of its, just the way it's naturally occurring phospholipid makeup, so it gets to the site much better. Okay, you all know, I'm pretty sure, that if you compare a whole food supplement to a synthesized supplement, if you just look at a multi that's whole food, the numbers don't even compare. You're looking at 5 milligrams versus 50 milligrams of this B, right? You're looking at 30 milligrams of vitamin C naturally occurring versus putting 500 in. It's a day and night. It's apples and oranges comparison, all right? Whole food, you can get away with less, do a lot more because all the cofactors are there. So it enhances the uptake. So that means less work for the body to do. Okay? Topicals. People love topical stuff, extra stuff, because it makes them feel better. Okay? So along with the internal, they love doing topicals. So I think you've all heard of arnica usually it's herbal and or homeopathic. It's great for contusions, hematomas. It's really one of the first things that you'll normally throw in if there's been a major injury with hematoma. It reduces the inflammation in the area, good for sprains and strains. So you can massage it in. There's a gel from Boron, there's a oil from Dr. Reckwig that you can actually massage in over the area. It helps to get that flow going, and it helps to it controls the inflammation at the site, okay? This, for what we're talking about here, of injuries, fractures, and tendonitis, R55 cream, probably one of the best at it. Disclaimer, anything I say about this is totally biased because I formulated it, but it's still the best cream there is. So, it's a homeopathic cream. It was formulated after we lost a wonderful anti-inflammatory cream called Traumeel out of Germany. When we lost that, we started production on this. It took about 2 years to make with Germany, and they're crazy in how they want things done. So almost 2.5 years later, we come up with this, and it was not to replace Traumeel, it was to go beyond what Traumeel does. So injury is not just inflammation, as we know. Injury is also a lot of tension, tightness, right? And that's where all the pain is, inflammation and tightness. And then, as I just showed you before, when you do all of that, you decrease flow out, so you get all this congestion and swelling and everything. This cream is about all of that. Reducing the inflammation, decreasing the swelling and tension so we can get the healing process going again, all right? A homeopathic anti-inflammatory. Tissue repair, Ruta, very important for connective tissue repair, all right? Mag-Phos, magnesium, to get rid of the tension, so along with the anti-inflammatory and the muscle tension, that's how you get rid of the pain. But one of the most important things is helping your lymphatic system. Lymphatic system is your sewer system, all right? When you come to anatomy physiology and she talks about lymphatic system, pay attention, all right? To me, that is one of the most important systems in the body because it's your sewer system. And if your sewer system is backed up, we got toxic overload in the whole body. Everybody talks about liver, all right? Liver is metabolic toxins as we're trying to get them out in general through the breakdown. But once it's outside the cell, right? If that cell is still bathing in its own crap, how are you going to get healing happening? You have to take all the toxins out. And the lymphatic system does that. It actually takes everything away from that area and starts the healing process. So pay attention to the lymphatic system, okay? And that's what was important in this cream, was getting the lymphatic system through the gallium, which is cleavers, moving. You accelerate the healing process once you get the flow back, right? All pathology is obstruction somewhere, stagnation. Get that flow happening, you get the healing process happening. Okay, so nice little cream. Now let's go about repair, okay? Enhanced cell and tissue repair. Joint, ligament, connective tissue support, and we need collagen stimulation. So, importance of nutrition. This is why you're here. Doing this 1 year course, maybe 2, depending on if you're doing part-time. Okay? The cell is immortal. It is merely the fluid in which it floats that degenerates. Renew this fluid at a regular interval. Give the cells what they require for nutrition. And as far as we know, the pulsation of life can go on forever. French surgeon biologist. Okay? Feed it what it needs. Get the repair mechanism happening. We can't get the repair until we just talked about getting rid of all the other stuff. We have to break all the barriers down, and then we can repair. You can throw all these repair nutrients in at the beginning, and if you never got rid of the inflammation, just bouncing right back. You're never going to get it to the site. Okay? So make sure you go through the process. Okay? And you have to tell people that. It's going to take some time. This is how we have to do it. Arthritis falls into this. All about inflammation, swelling, erosion of the cartilage, okay? Many factors to arthritis, okay? Genetic makeup, physical demanding job, previous injuries, all right? All the different types of foods. If it's acidic foods that they're normally eating, they're gonna hinder their healing process, but it's also gonna accelerate the breakdown in the body. So, first things first for injuries. There's a liquid version of that cream. Injuries of all types, cuts, scrapes, sprains and strains and bone fractures. Sprains and strains, number 1 injury. Right? Fractures was number 2. This homeopathic, and I didn't even talk about homeopathics. I didn't even ask if anybody knows homeopathics. I should have. All right? Who does not know how homeopathics work? Hands up if you don't know. You guys know homeopathy?
A little bit.
If nobody put their hand, I'm not going to explain it now. Okay, now, I see homeopathy as the body's initial stimulation, getting you over that hump when something is stuck. It's stagnant, the energy in the body. And by the way, the whole body is flow and energy. And if somebody doesn't understand that and they look at just pure evidence-based medicine and they don't understand the energy of the body, it's a complete flow. If you hinder the energy, you hinder the healing. You start pathology. So homeopathy to me is about getting over that hump. Getting things moving again to the right path, okay? That's all we're doing over here. We're looking at the inflammatory mechanism, getting that right, the repair mechanism for tissue, for cartilage, ruta, setting that process off at the body at a cell level, okay? So all we're trying to do is decrease the inflammation. Again, this is the internal, the other one was a topical, all right? Setting off the ligament and tissue repair with the ruta, and again, keeping that flow happening. So for injuries of all kinds, concussions, post or pre-surgery, all right? This is what the drops are about. So you're doing this internally to start that whole process. I'm gonna skip this. I don't want to explain gemotherapy at this moment. So we're going to go to the general nutrients for connective tissue repair. All right. I think everybody knows glucosamine and MSM. General building blocks are connective tissue, arthritis, okay? So this formula here, Recovery Extra Strength, also has the hyaluronic acid in here. So that's true moisture into that site so you can get that cushioning back again. But something that they do different, or majority of the other guys, yes, everybody's gonna have glucosamine and MSM as the key building blocks, mild anti-inflammatory. Grapeseed extract and green tea. Circulation. If you don't get circulatory flow, you're not gonna get nutrient delivery. And then you're not gonna get junk moving out. This is the bonus of how this really works. Getting that circulatory support, okay, movement out. So the thing about this, it comes in a powder, which is fine, 2 teaspoons to get you that full dosage, or 10 capsules. It's a lot of capsules, so that's why most people will do the actual powder for this thing. So this is half the dosage. 5 capsules, 1 teaspoon gives you this. Normally therapeutically, you're looking at doubling that up, okay? For the lazy people, because there's a lot of lazy people. Platinum Relieve X. Each soft gel giving you 500 of glucosamine. Your normal therapeutic is about 1,500. When you throw other stuff into it, you can bring it down to about 1,000. If I come back here, double the dosage, you're at 1,500. All right? Each soft gel giving you 500 with turmeric, with boswellia, with other anti-rheumatic herbs, plus fish oils at a high EPA, 265. 2 or 3 pills of this gives you not just your herbs, all right, not just your rebuilder, but also that fish oil we just talked about, providing even more support. That's for the lazy people. They do a very good job. Yes, they're going to be big soft gels. They're not going to be vegetarian. The other one was vegetarian, right? But it does a very good job and an easy way to do it, okay? Here is probably the fastest way to help with arthritis, eggshell membrane. Eggshell membrane has naturally occurring glucosamine, hyaluronic acid, and chondroitin sulfate and collagen. Remember that whole food thing I mentioned? Low dose, 1 pill a day. That's your general maintenance. 2 for short term at the beginning. That's all you need. It's basically like the whole food version of glucosamine. Low doses going a long way to get the job done. This is basically taking over the whole glucosamine side of things, right? Because you can get away with less, unless you're allergic to eggs. If they're allergic to eggs, not going to happen. All right. Just another company that's got it, Genuine Health, eggshell membrane. They have it by itself at the 500 milligrams, or with the anti-inflammatories in it. Again, that arthritic support. Break down the inflammation, get the rebuilding happening. This is truly what most people have gone to for arthritis, rebuilding and repair. What glucosamine did in about 2 months, where you start to notice it, eggshell membrane is doing in a week or 2. That initial process of starting to get rid of that stiffness and pain. That's why people have really gone over to this. Low dosage and quicker acting. Here is probably a hidden gem of products. This is actually eggshell membrane plus undenatured type 2 collagen. So rheumatoid arthritis and major damage to the tendons, ligaments, connective tissue. We know what this is already giving you, the glucosamine, chondroitin, and type 2 collagen. This right here is preventing further breakdown and really helping with the repair of that tendon ligament. This is a 1-a-day formula. It's not cheap, but when you can get a 1 a day versus giving somebody 3-4 a day, it makes more sense, and it's already combined for you, okay? So for osteoarthritis, but more so for rheumatoid arthritis too, where there's really nothing. Rheumatoid arthritis is about inflammation and really this thing right here, okay? Add-ons, so I think we're almost there, okay? Add-ons. You can throw everything you want, but if you don't have the right gel and the glue to get the job done and strengthen and bring back, very important for connective tissue is the elasticity. Connective tissue is supposed to be flexible, right? If it's not, and we got scar tissue, and then people get repetitive injuries, all right, because it's not as flexible as it should be. Bones should be flexible. All your tendons and ligaments obviously need to be flexible. Silica basically gets all this calcium, glucosamine, chondroitin, everything to that site better, but it also makes it more flexible. So you've got that give that you need. It's truly one of the most important things you need for all connective tissue support. Adding in the silica will give you the flexibility when it heals, so there's going to be less chance of repetitive damage happening. Okay, so in your case, along with that wobenzyme, adding in the silica is going to, as the scar tissue is eventually getting up, it's actually making it weaker too. But you need that connective tissue support to get that strength and flexibility back. Silica is one of the most important nutrients you can do. I prefer the biosilica. It's a biologically active form of silica in the body over the horsetail guy, over the bamboo. All right, this truly does the best job. Always 2 capsules. I don't care if it's maintenance or therapeutic. Doesn't matter if it's for skin or connective tissue in general for injuries. Okay, a lot of people just do it for strong hair and nails. All right, but it's truly one of the most important things you can do for all connective tissue. That includes blood vessel support. If you can't pump right, and blood vessels are made your collagen, right, then you're not going to get the nutrients there either. So very important for that. 12 drops or 2 capsules, really what you're looking at. This in the liquid is the most god-awful tasting thing there is. You could probably bite into krill oil and it won't taste as bad as this does if you took it straight. So this is why they tell you to put it into juice. I've had in my class get people to take this straight just so I can prove a point. There's people who've done it and I've proven a point. All right, it is the most god-awful tasting thing. It smells like fish, tastes like fish, but there's no fish in it, just silica in it. Okay, that's all it is. That's why most people end up doing the pills. Okay, but you can put it in juice and you're fine. And I think one of the last things, if there's bone issues, fractures risk was there, right? Along with your calcium, magnesium, you should have vitamin K. So D, we know, is going to get the calcium through the gut and to the site. K is going to make sure that calcium gets to where it needs to, into the bone, and it's put in properly, a proper matrix, right? If you just dump calcium in and it's sitting like this, you got a greater fracture risk. But if it's sitting properly in the matrix, right, it's going to be more flexible, stronger. So K is very important, all right, for fracture side of things. And that's it. Your body actually reminds you about your age and your injuries. The body has a stronger memory than your mind. That's a chronic nature of things. If you do not heal, if you just put a Band-Aid on it, it will come back to bite you, all right? It will hinder what you do. That's it. There it is, May, June, October, November. Email me if you have any questions. If you want a PDF of this, all right, get that. Any questions?